Hello, Dr. Brian Abelson from Kinetic Health. I'm going to go over what we call lower cross syndrome. This is a very common syndrome we see in clinical practice. There's several reasons why this can happen. Most common one probably is from sitting for long periods of time. If you're working on a computer or driving a lot, this is a very common thing we see in clinic. Okay, so let's just give you an idea what this is. When you sit down and you're there for a long period of time, your pelvis rotates anteriorly. So why don't you just get a little bit of anterior rotation there? Good. What you'll see here is an increased curvature in the lumbar spine. Several things happen here. Your hip flexors are really tight at the front here. Muscles that are deep called the iliacs and psoas. They become short and contracted. What happens here too, when they're short and contracted or hypertonic, as the pelvis goes forward, the paraspinal muscles, your back muscles essentially, they get very tight and contracted also. You start to get back pain. You notice that you get a lot of tension there after sitting for a while. Now, we also look at things in terms of oppositional muscles. For my bicep to contract, my tricep has to relax. Those are oppositional muscles. The oppositional muscles of your hip flexors are your glutes. So consequently, for sitting for a long period of time, basically turns off the glutes. This is called reciprocal inhibition. So this means that you don't have your glutes firing correctly, so you start to lose stability in your core. Your lower extremity becomes very unstable, all from sitting. So several things happen here. Tight hip flexors, tight paraspinals, weak glutes, but also weak abdominal muscles. So to correct this, we need to do a combination of both strengthening, stretching, and myofascial work. This is a very common syndrome that can be addressed, but it's not a matter of just going in and dealing with one issue. It's looking at how everything is affected from front, anterior, posterior, and making sure that we bring everything back to its neutral position. Come on back up here. Good. But this is more or less where we should be, but like I say, a huge amount of people that come to the clinic have this syndrome.